Maria Ducharme, and I'm the president of the Miriam Hospital. It's quite an honor for me and for the hospital today to host this incredibly important event. First and foremost, I'd like to welcome our honorable leadership, Governor McKee, President Ruggiero, Speaker Scacarci, Senator Goodwin, and Representative Ackerman. Thank you for being here. I'd also like to welcome our partner and supporter at the American Cancer Society, Corey Chandler, Director of Government Relations for the American Cancer Society and the Cancer Action Network. Dr. Babineau, our president and CEO of the health system, unfortunately cannot be with us today, but he sends along his thanks and his heartfelt congratulations. As a hospital and healthcare system, we are committed to providing every Rhode Islander with timely and essential screenings to detect cancers as early as possible. This legislation will surely help us to achieve those goals and save lives from a stealthy and deadly disease, colorectal cancer. Senator Goodwin, in sharing of her own story in such a moving and personal manner, and her advocacy for cancer screening coverage even before her own personal encounters, will improve access for colorectal screening exams and laboratory tests throughout our state. We have all been incredibly inspired by her courage and are immensely grateful to her for her dedication to cancer prevention and public health. Thank you, Senator Goodwin. So again, Senator Goodwin, Representative Ackerman, Senate President Ruggiero, and Speaker Scacarci, thank you for your leadership, and thank you to the American Cancer Society for your advocacy. And thank you, Governor McKee, for signing this important bill into law today. This is a significant step towards early detection and treatment of colon cancer for our state. Welcome, Governor McKee, and thank you again.
Yes, thank you. Thank you, Dr. Ducharme. Good afternoon, everyone. And it's great to be here. I want to thank Senator Majority Whip Mary Ellen Goodwin and House Deputy Majority Whip Mayor Ackerman, championing this effort and work tirelessly to ensure this bill becomes law. So thank you very much. Both good friends. I consider both of you very good friends. But today, we signed the Mary Ellen Goodwin Colorectal Cancer Screening Act into law and provide full insurance coverage for colorectal cancer screenings. So I want to thank the Speaker Scacarci, Senate President Ruggiero, for your leadership on this issue that is deeply important to so many Rhode Islanders. Mary Ellen, your personal story, your passion, and your unwavering advocacy, you've inspired us all. And I'd like to recognize the American Cancer Society, Cancer Action Network, the Partnership to Reduce Cancer in Rhode Island, the Colon Cancer Alliance of Rhode Island, and all the advocates who have been working on this bill for years. This is no question. There is no question. Expanding access to colorectal cancer screenings will save lives. This bill will save lives. And I'm proud to sign this bill today into law and remove barriers that many Rhode Islanders face in accessing crucial screenings. This year, hundreds of Rhode Islanders will receive a diagnosis of colorectal cancer, but increasing access to screening will lead to better outcomes. This bill gives us hope, and this bill saves lives. Before I turn it over to Speaker Scacarci, I just want to make a note. The color associated with colon cancer awareness is dark blue. So, Senator, I've asked the State House that the dome at the State House tonight will be lit in blue. And again, I thank Rep. Ackerman and yourself for championing in this bill, and it's an honor to be here today to celebrate the signing of this vital piece of legislation. Congratulations, and with that, I'll turn it over to Speaker Scacarci.
Thank you very much. Thank you, Governor. Thank you all
for being here today on a very important day. And it's clear, why we're here. This has been not been a good week for the House or the Senate or the governor. We've been working very hard on a whole host of issues. And I'm a news speaker, so I got up today and I said, why am I doing this? What are we doing? It's like one bad news day after another. And then I looked at my schedule and I remembered I had this day. And I said, that's why we do this. For days like today. For days for Mary Ann and for Mia. And notice I didn't say whip or representative or senator, because those are in titles. There are people behind those titles, people who fought very, very hard to make this day a reality. I can speak from the House perspective. This bill has been around for 3 or 4 years, and Mia Ackerman never stopped fighting for it. One setback after another setback after another setback, and she would just keep fighting. And that's the spirit that she has. I can say the same thing about Mary Ellen, who we all know has a personal battle she's fighting, but such integrity, such heart, such drive, never to give up. And we all are here for you today, both of you. Thank you for what you continue to do to make this day a reality. Yes, absolutely. The Senate President shares the passion that make this important. You heard the remarks the governor gave. This will save lives. And that's why I'm here. That's why we're here. That's why we run for office, to make a difference. And today's one of those days. So we can celebrate today. The governor's going to sign this bill into law shortly. And the key is early detection. And this bill, as the governor said, removes the barriers so people can get detected early. It's simple, it's easy, you do it in your home, it's certainly cost effective, it's non-invasive. You wonder why we didn't do this 3 years ago. But we've done it today, and we're proud of that, and we look forward to it. And I'd like to turn it over to my very, very good friend, the Senate President, Dominic Ruggiero. Thank you.
Thank you very much, Mr. Speaker, and I want to thank everyone for being here today. This is an absolutely a phenomenal event, and I know a lot of you know the history of the legislation that the governor will be signing today. Before I start with my remarks, I'd like to recognize the presence of a number of my colleagues in the Senate. Leader Michael McCaffrey, Chairman of the Finance Committee, Ryan Pearson. Senator Bridget Valverde is here, Chairman Joshua Miller, Chairwoman Dawn Oyer, former Lieutenant Governor Charles Fogarty, former President of the Rhode Island Senate, Senator Teresa Piver-Weed, and former Senator Stephen Al. So I want to thank them for being here, and I want to recognize their presence. I'm happy to join everyone here to be with the governor to sign this very important piece of legislation. I want to thank all of you for playing a role that you've played regarding this legislation. But I'm going to let others speak about the merits of the act. I want to talk about my friend, Mary Ellen Goodwin. The legislation is rightfully named after Mary Ellen Goodwin because of her incredible advocacy on this particular issue. For years before her diagnosis, she fought to raise awareness about different forms of cancer, which is why she was the natural person to be able to sponsor this legislation. More than that, Mary Ellen is a person who has always given everything she has to care for others, whether it's the residents of her Smith Hill community or really anyone she ever came in contact with. That is especially true if a person is struggling, down on their luck, or facing an illness. She is always looking out for others, regardless of her personal situation. Mary Ellen is truly one of the most courageous and strongest people I have ever met. And everyone who knows and who serves with her, or has served with her, has grown not only to respect her, because she is a very strong leader, but also regard her as a friend. I cherish our friendship. And I greatly appreciate all that she has done to raise awareness about this issue and so much else for people in need. Every one of us is standing behind her as she undergoes her own personal battle with cancer. But Mary Ellen would never want this to be about her. This is about raising awareness. This is about removing financial barriers to life-saving cancer screenings. This, as the other speakers have said, is about saving lives. Thank you, Mary Ellen, for your strong leadership on this issue and on many other issues, and thank you for your friendship. And now it's my pleasure. Now it's my pleasure to introduce my good friend, Senate Majority Whip Mary Ellen Goodwin.
Love you too. Thank you. Thank you, everyone. And good afternoon. Thank you all for being here. And thank you, Mr. President, Mr. Speaker, Governor McKee. Thank you very much for your remarks. And you too, Dr. Duchamp. What a great afternoon. This was supposed to be outside, but we can't control the weather. And I want to thank everyone for coming out to me today. It means so much to me personally, and for supporting this critical legislation. I believe this bill will save lives. It removes the most significant barriers to getting life-saving screenings and colonoscopies, and that is the cost. The cost can be significant. Even with insurance, the cost of a colonoscopy can be hundreds or even more than $1,000. No one should delay or forego this procedure because of the cost. And now, thanks to this law, no one will have to. And that is because of the advocacy of so many. I particularly want to thank the American Cancer Society for their efforts. When Robert Dulski and Corey Chandler asked me to put in this bill back some more than 3 years ago, I jumped at the chance because I knew how important it would be for all Rhode Islanders. Since that time, my own personal experience has reinforced just how important this bill is. I want to thank you, President Ruggiero, my dear friend of more than 30 years. I truly love you. You are a good man who has embraced this bill and made it a Senate priority. And all of my colleagues in the Senate who are here and who voted for this bill, it passed unanimously all 3 years. And thank you, Mr. Speaker. You are a good man. You are a man of your word. And he truly is a good man. One day, after this bill passed the Senate, the Speaker publicly told the press he would also make this a House priority, and that it would be done before our Easter recess. And that is exactly what, in fact, happened. Thank you, Mr. Speaker. And thank you, Mayor Ackerman, Representative Ackerman, for standing beside me for 3 years as we battled to get this most important legislation signed into law. Thus, we have today. So thank you, Mayor. I just want to say I was truly overwhelmed a few weeks ago when the Senate went in the Senate session. The President surprised me with a Senate floor amendment to give this bill my namesake. I am exceedingly grateful to him and again to all of my colleagues for that and for all the support they have shown me in the last 20 months since my own diagnosis of cancer. The Senate is like a large family, and I am blessed to be part of it. Thank you to all my colleagues and to all the staff who stand by me as I battle forward. I also want to thank you, Governor McKee, for your strong support of this bill, but most importantly for highlighting it today in a very public signing ceremony, because it is very important that Rhode Islanders know that this law exists. Next, I want to thank the doctors and nurses who work at the Miriam Cancer Center. They are the true heroes in my book. Dr. Duchamp, I cannot overstate how nurturing and caring the staff are here at the Miriam Cancer Center. They do everything they can to provide the greatest of care, and really, they go above and beyond what is required. I am so grateful for all of them and for all that they do. I'm blessed to be joined here by, I think, Dr. Breakstone. She is my oncologist who has brought me this far. She is in the back. Thank you, Dr. Breakstone. You are phenomenal. I'm blessed to have you. Thank you. And I say that, but so many of her fellow doctors. Even today, I spoke to Dr. Schiffman, who said, I am in such great hands. He's known Dr. Breakstone since, I think, what do you people called early on, interns or residents, something like that. But he said he's known her all her life, and I am in such capable hands, but I know that personally. And I wanted to point out Faye and Carolyn. Faye was my first chemo nurse, and I was so petrified that first day, getting the chemo into my port. I didn't know how I would accept it or what it would be like. She was so tender and so kind. Unfortunately, Faye and I are divorced because she no longer works on Monday on the day I received my treatment. But I was further blessed to have Carolyn, I guess, be assigned to me. And thank you, Carolyn, for your kindness and your tenderness. Thank you. You make my every other Monday visit to the Marion Cancer Center enjoyable, if we can say that. And lastly, and mostly, I want to thank my family and Charlie and my dear, dear friends, some who have come out here today. Your love and your friendship means more than I could ever say. I am grateful for the time we spend together and the great times yet to come, the thoughtful words and the gestures and your incredible kindness and your overwhelming generosity day in and day out. I know it's not easy for all of you, but thank you. It comes from the very bottom of my heart. And lastly, I just want to let you all know that your support over the last 3 years to get this legislation means more than you can ever know. Thank you all very much. I do want us to recognize and point out just a few people just for a minute. I wanted to recognize Chairman Miller. Thank you, Josh, for shepherding this bill for 3 years. A lot of times, the sponsor of the bill gives testimony as chairman now, and then we hear from witnesses, and then the real work is dumped on the chairman. And thank you, Josh, for shepherding for this for a number of years. I'm joined by one of my closest friends in the Senate, Teresa Piver-Weed, who is currently the president of the Rhode Island Hospital Association. Thank you, Teresa, for your friendship. I want to also thank my very dear friend, Stephen Alves, former chairman of finance, who calls me no less than 3 or 4 times a day. See how I am? Thank you, Stephen. I want to also recognize and point out Chris Boyle, who's here representing Blue Cross. Thank you, Chris, for your effort over the years. You stood by me. You stood by this legislation along with Representative Ackerman. And it wasn't easy for some of the large insurers because this comes at a cost to them. So thank you, Chris, for your effort. I hope that I didn't miss anybody. All of my colleagues from the Senate, thank you very much. Your faces are just so beautiful to see, and that of the staff and my family and my nieces and nephews. And thank you to my sisters for decking my nieces and nephews out in coal and blue. And again, Governor, thank you for the surprise of lighting the State House tonight. That's it from me, folks. Thank you all very much again. I'm sorry. Now it's time for me to introduce and welcome Representative Mia Ackerman. Welcome.
Good afternoon. I think Mary Ellen said it well, but I have to say that this really is an exciting day as we fight against the second leading cause of cancer deaths. With the statistic that about 500 Rhode Islanders will be diagnosed with colorectal cancer this year, there was no time to wait. And we know for every dollar spent on these screenings, we will save $3 in treatment costs. This bill signing today will save lives. I know we've all said that. Can't say it enough. But I want to thank the Cancer Society, Robert Dulski and Corey Chandler, and Speaker Shikarchi, of course, and Senator Ruggiero, Senate President, and of course our Governor, Dan McKee, my colleagues in the House, Senator Goodwin, Dr. Adrian, Dr. Shaw for their advocacy, and all the others who came and helped us all to get this through. I want to thank everybody. Thank you.
No, you're fine. Good afternoon, everyone. My name is Corey Chandler. I'm the Government Relations Director here in Rhode Island for the American Cancer Society Cancer Action Network. I'm here today not only on behalf of my organization, but on behalf of the nearly 500 Rhode Islanders who we expect will be diagnosed with colorectal cancer this year. Colorectal cancer is one of the few cancers that can be prevented through screening. With increased access to screening, like everyone else has said today, we can save lives. Countless stories have been shared over the past 3 years since this bill has been introduced about the consequences of existing barriers to screening. These include later stage diagnosis, poorer health outcomes, and lives lost. One of our volunteers that advocated on behalf of this bill spoke to exactly that. She delayed her screening in part due to financial concerns and was ultimately diagnosed with stage 3 colorectal cancer. Her story is far more common than it should be. But what is happening here today will change that. This law removes a major financial barrier keeping some Rhode Islanders from receiving their recommended screening. I'm so grateful to bear witness to Governor McKee signing this bill into law, and with that, celebrate the opportunity for more Rhode Islanders to be screened, ultimately saving lives and allowing more Rhode Islanders the time they deserve with their loved ones. I will close by echoing all of the thank yous you've heard today to Governor McKee, Senate and House leadership, also to Senate Majority Whip Goodwin and House Deputy Majority Whip Ackerman for their incredible leadership over the past 3 years on this issue. We were honored to be involved in the effort to pass the Mary Ellen Goodwin Colorectal Cancer Screening Act. Whip Goodwin has been an inspiration to cancer patients around our state, and we owe a debt of gratitude to her for the suffering that will be prevented thanks to this law. Thank you.
The advocates are in as well.
Dr. Breakstone?
Dr. Breakstone.
Okay.
Yeah, what do you want? Dr. Breakstone?
Senator, let me take your folder. Let me take your folder.
Sorry. Yeah, she's coming. Rimini?
So we have the first one signed.
Right there. She's coming.
Let's get over, Senator.
Mike, come over here.
Rimini. Doctor, come in.
Dr. Kamala, President.
Thank you very much, Governor.
Thank you, Michael.
This is exciting. Yeah. The speaker said this is the reason we do the work we do. Right? So thank you so much. The advocates here, right? Here's first one.
I have one, Governor.
Okay. Doctor.
This is why I called this time. I thought you were
Yeah, that's good. Mary Ellen, you can assign me, you can assign as well. But I have two more over here. Doctor, there you go, doctor. And
Where's your name, Governor? Not yet, too
not
early?
yet, too early. This one's day 57.
I'm gonna need another one. I have everybody but yours.
Day 57. Thank you, everybody.
Thank you.
Thank you all for being
Have a
here.
great day.
Yes. Thank you. Yes. Thank you, Governor. Yes. Okay. Everybody in here? Yes.
Come on. Come on, Mia.
Okay, good? Okay.